Hello, it's Dr. Farhan Tahir joining you from Philadelphia, a city of brotherly love. I want to thank you for being here today with me. It is my honor and privilege to welcome you to iRoom, a resource for inflammation, arthritis, and autoimmune diseases. As a pain management and autoimmune disease specialist, I want to help you through this journey to make you stronger and to be able to face these challenges with great strength. I am here to help you through this journey. So let's get started. Today I'm going to talk to you about a situation if a family member at home has been exposed to COVID-19 and what things you can do to reduce the transmission of infection among the rest of the family members. First of all, there's no reason to panic. In patients who have actually good health to begin with, have great outcomes. Just making sure that the patient is adequately hydrated and symptomatically treated, meaning if they have fever, medicine to help reduce the fever, they are staying hydrated, they're getting medicines to help relieve with their cough or shortness of breath, that is enough to help people regain health, although it takes about 2 to 4 weeks for them to completely recover. But at this time, nothing much is going on, and patient would benefit if you reassure them and support them. So first of all, as a family member of a person who has been affected with COVID-19, what things we can do? First of all, family members should get involved in patient's general health and medical care. So one person in the family who is able to understand physician's instructions to care for a patient at home is important. And those may involve understanding what is the patient underlying diagnosis, what medicines and what times they need to have those medicines given to them. Make sure that the patient who is infected has provisions for his basic needs, which will include, of course, supply of their toiletries, supply of their personal clothing, shoes, their towels, and of course, if preferably, they should be confined in a single room in a home where other people are not going in and out. And of course, the purpose is to not make that patient feel isolated, but to make sure that they're taken care of at home, but are not a source of spreading the infection to the rest of the people. You should be responsible to kind of monitor their symptoms. If they feel that the symptoms are getting worse, maybe shortness of breath or wheezing has started, and you need to take them to a local provider, a doctor, I would recommend you to call the doctor ahead of time so that they know that a patient with COVID-19 positive case is coming. They might have to make some arrangements. And in some cases, they're asking people to actually stay in the car and the parking lot, and a team member goes and gets the information and provides them the care they need, in some cases prescriptions. So monitoring the symptoms of the patient at home and communicating with the physicians outside through a phone is important. A lot of times now, telehealth is a great way to actually incorporate that into your daily life. Everyone has smartphones, doctors have smartphones, and connecting them through that digital virtual visits is a great way. Many times prescriptions can be called in and electronically sent to the pharmacies. Again, making sure that no visitors are allowed in that home, whether it's anyone with ages above 50 and above with comorbid conditions should not come to that house. Neither the patient should be allowed to go outside, as common sense tells us. Making sure that the sick person is not touching pets, although we don't believe that COVID-19 spreads through pets, but it is important that the pet is not exposed to the sick person. Although you can show them through the window if they are attached to the pet, and sometimes that is an emotional support that you can provide. Rooms or the homes, if weather permits, should be well ventilated. Cross ventilation helps prevent the infection. Making sure that everyone at home now avoids touching high contact surface areas such as countertops, doorknobs, bathroom, toilets, all those areas where everyone goes and touches should be cleaned frequently with household bleach. Patient is advised to avoid touching their face, and nobody else in the home also should touch their face. This is a habit that most humans are used to of it. On average, a human touches their face 18 times in an hour, a very high number. I know that a lot of people are worried about personal protective equipment, and you don't need to hoard like 50 face masks at home, but maybe a couple at home in case of this situation is important, because you can give one to the patient who can wear this if they come out in a common area of the home, or if you go close to them and they are in need of your physical help to change, especially if they're old, or they have body secretions that need to be wiped and cleaned. In that case, you preferably should have a disposable gown and a mask and glove. You can get those basic ones from the stores and use them. You don't need the N95 if you mean to protect you, and you will make sure that you are washing hands soon after the exposure. When you dispose of any protective equipment, make sure you take off your gloves, throw them, and then take off your gown or mask and throw them in a bag. Have them in a bag separate, and then edit it in a disposable container. Also making sure that you are not sharing any personal utensils. Their utensils need to be separated. They should also have their own personal towel and things of that nature, so that they can avoid contamination. Use of laundry is important because the patient clothes need to be frequently washed, and their beddings be washed ideally every day if possible. Provision of water and other detergents is important, and having those supplies available is great. Making sure that your patient does not feel isolated, and I hope that with these tips, all of us will remain safe and would be able to care for any family member if they get sick. I hope you find this useful. Stay tuned. Thank you for your time.